Hello, I'm Dr. Brian J. Moran, Medical Director at Chicago Prostate Center, and today I'm going to speak about the impact that the baby boomer generation will have on the disease of prostate cancer and its subsequent treatment options. I think that the baby boomer phenomenon is something that this country has never experienced before. Every day, 10,000 Americans turn age 65. Naturally, this will increase the number of men that are diagnosed with prostate cancer until the year 2030, when the last baby boomer turns age 65. So this has many implications, one of which is today people are appreciating their quality of life issues, urinary issues, sexual issues, bowel issues, and I think that today's generation of men in their 60s is far different than my father's generation that would basically just take their physician's word for it without doing some consideration of treatment options. And so that's where we are today. It's quite fascinating. When you also look at the technology evolution occurring today with regard to all of the sophisticated surgical techniques, the newer radiation technologies and modalities, including IMRT, proton beam therapy, obviously the advances made in prostate seed implant, which is what we specialize in here in Chicago. These all have implications as to achieving high cure rates and avoiding side effects that would impair one's quality of life. So our philosophy here simply is less is more. We're very excited about the future, and that is that we now no longer here at Chicago Prostate Center view the disease of prostate cancer as one size fits all. In fact, we think it's a spectrum disease. In other words, very similar to autism, where many of the autistic disorders range from very slight to profoundly severe. The same occurs with prostate cancer. Some prostate cancers, in fact, it's not insignificant number of prostate cancers, are really insignificant in that they do not require treatment. That means that they more than likely will not progress. They would not pose a threat to the health and life of that individual. And that person should then be able to go on and maintain their current quality of life without taking the risk of side effects from treatment, which is very important and I think understated by our medical community to the patients. I think that if we are able to identify where a man with prostate cancer sits along this spectrum from very non-aggressive disease to very lethal disease that will take one's life if left untreated, you have to define where that individual is on that spectrum. That can be done a variety of ways. We believe that transrectal biopsy is inadequate to assist us in putting people in that risk spectrum. We also are using molecular biomarkers. These are tests that we can run on the actual tissue that was removed from the prostate to further help us identify cancers that are aggressive versus those that really are not that threatening. So I think those are exciting technologies, and clearly we're using them more and more frequently. Finally, as I mentioned, transrectal biopsy, in my opinion, is not adequate to truly assess the amount of disease present in the prostate gland. Frequently, it will miss prostate cancers that exist up to 40% of the time. This is in the published literature. We are currently using a biopsy technique here in Chicago that we call STPB, stereotactic transperineal prostate biopsy. And this biopsy is done through the skin behind the scrotum and in front of the anus. It is used with ultrasound guidance that is in the rectum. The patient is asleep, and a template is used to direct the needles into the prostate gland. More importantly, on the template, there are coordinates along the X and Y axis that are recorded at the time the biopsy is obtained. The benefit of this is if cancer is identified, not only do we have a diagnosis, we know exactly the location from which that cancer was obtained. This has implications as to how we are able to customize our treatment of radiation implants. And I think this is the new era of sophistication that we're going to be offering our patients based on this biopsy technology. One of the benefits of this biopsy is that the infection rate is essentially zero. Transrectal biopsy is problematic in that infection that can be quite serious, requiring intensive care hospitalization, is not negligible. It does occur. People can get very sick from biopsies through the rectal wall. So I think that's where we are today, and I think that the medical community, I just returned from a think tank meeting with many of the world's experts in Charleston, South Carolina, and we all agreed prostate cancer diagnosis and treatment management options are changing and they're evolving, and we need to appreciate the newer technologies and let them assist us in counseling patients. Thank you very much.